This is Dr. Jean-Guy here, and today I would like to talk to you about spinal correction. So I've been in practice now for 25 years. We have accumulated between all of our doctors, 60 plus years worth of experience. One of our specialty here, if you don't know, is we specialize in spinal correction. I guess to put it plainly is we do spinal rehab for the spine or physical therapy for the spine as it relates to structural correction. And some of the tools that we are using, or maybe that you're using already, is we use those what we call the Dennerolls. And the Denneroll is just the name of those foam that we use that are mechanically engineered, right, to structurally change the spine. And I want to tell you a little bit about that, right? So there's a lot of different Dennerolls. Actually, there's some for every single parts of the spine. And every one of those Dennerolls have been mechanically engineered to change the spine, to structurally put a force into the spine in order to change it more towards what normal would be, right, for proper for spinal health. So some of you out there, or maybe you've looked it up, right, or maybe you're like, well, I found one on Amazon. And I just want to, give you there's a few things that I want to share with you because I see those mistakes that are being made every day. Some people, well, the first thing is, I'm just going to buy something on Amazon, right? A knockoff version of those Denneroll because they're the same. And I'm here to tell you today that they are not the same, right? Matter of fact, those Denneroll products, they've been researched in the medical literature. There's probably 8 or 9 peer-reviewed journal right now with randomized control studies, right, with the Denneroll products that, have shown, right, that we have data that it will change the spine towards what it needs to be, how you can be more mechanically sound in a gravity environment. So what I want you to know this morning is, number one is the knockoff version, they don't have any data that it changes spine, right? You might think that it's the same, but I want you to know that I guarantee you that it's not the same. Number two is it should be prescribed by a doctor. Why is that? Well, that's pretty simple. Is like, can you see how they don't have the same? There's a lot of different size. If you use the wrong size, you're gonna make your spine worse. I hear that all the time, even from our own patient. Because if you don't put it in the right spot, right, and you don't do this at the right time, then what happens is you can be causing harm versus doing something good. So that's something important. So don't go for the knockoff version. That's number one. Number two, make sure that it's prescribed by a doctor so you know for sure 100% that it's going to fit you for your spine in different area of your spine. And then last but not least, what's important here that I want to share with you this morning is sometimes people are like, well, I'm just going to do that at home and it's going to be fine. That's all I need to do. So I just want to remind you of like, what is the purpose of using the Denneroll or using, those Denneroll, sometimes people call them Denneroll, in different parts of your spine. What's the purpose of that? Right? So when you do an adjustment, so now remember, when you do an adjustment is we move the bones, we put them back in place, we break through the scar tissue, we take the pressure off the nerve so the body can start communicating better and improving mobility, right? So a person you can take the stress off the nervous system. So that's the purpose of like the adjustment. Then after that, we do exercises. And they're not any kind of exercise, they're neurological exercise to retrain the brain towards correction. So that's something that is important. And then we also, right, then we do traction. The purpose of traction is to stretch the ligaments because when you have spinal damage, spinal injuries that haven't been corrected or fully corrected at any ages, those ligaments, they're going to start becoming shorter. And what you do is the purpose of the Denneroll product is to stretch, is to put a force over time. Putting a force over time is different than doing exercises, and it's also different than getting an adjustment. And all those three things for spinal health and proper nervous system function, they are all needed. And that's really what I want you to know today, because oftentimes people don't really know that, right? They're like, oh, can I just do the Denneroll at home and I'm going to be all set? And I'm like, no, right? You can't do that. I mean, you can, but that's not how it's designed to work, because this is only addressing one part. It's not addressing the other part. If those bones don't move properly, right, your spine will continue degenerating even if you were to do Denneroll. So really what I want you to get out of this today, which is a couple things, is just to recap here. Stay off of the knockoff version, because there's no data that says that it's going to work. Matter of fact, I've tested many of them that people bring them in and it's not doing anything for them. So that's number one. Number two, it's got to be prescribed by a doctor, making sure that you're doing it at the right place. If it's not at the right place in your spine, it's not going to do anything. Matter of fact, there's chances it's going to be worse. And then last but not least is to make sure that understanding that there's a three-pronged approach to spinal health and spinal correction. Is the adjustment is like the most important thing that there is, because now you're allowing the nervous system to function better and improving the mobility in the spine. And then number two is doing some neurological corrective exercises. And then number three is then you stretch the ligaments, right? Stretching the ligaments, putting a force, pressure over time in order to change the soft tissue, to remodel the soft tissue. So hopefully this was helpful today, a little bit more technical, but I just want to make sure that all of our patients understand that. And if potentially you're not a patient and you're watching this, understanding how important that is. Now, how does that mean to just be involved into a spinal corrective care plan, right? What we do in the office here, obviously it's more involved, but when a person start to do things at home, there's like a purpose to those things. There's a reason why we do them, and they all play a part between having an adjustment and doing exercises, neurological exercises, and then also doing the traction at home. And doing the traction is we stretch the soft tissue, pressure over time in order to remodel the spine. So hopefully this was helpful today. And just remember your health is your wealth. Take care.